you've got to be tenacious and you've got to take some blows along the way, but ultimately not adhering to the truth is only going to cause great harm to public health and to patients. Yeah. So that's why I do what I do.
Yeah, but this is part of what you do. I mean, you're a cardiologist. You took a special interest in diet, the appalling sugar situation, the ultra processed food situation. I mean, this has been your advocacy basically all the way through your career, hasn't it?
Yeah, and tied to that, the overprescription of medications, overuse of surgeries, overuse of heart stents, something I trained in. I mean, there's I've published on this stuff and try to get increasing awareness on these issues, through alt media, but historically, actually, mainly through mainstream media.
Yeah.
But of course, as we've seen during the pandemic, this policy of suppression of information, of coercion, of mandates, of censorship, has meant that we have had to use alternative means to get the message out, such as alt media, such as yourself, the likes of Joe Rogan, Tucker Carlson, Megyn Kelly, Russell Brand, to name but a few, Jordan Peterson.
You've done all of those. You've been with all of
except Jordan I've not done yet, although I know he's interested in getting me on his show at some point, and we message each other from time to time. He does follow me on social media. But yeah, I think the other thing to mention that I think will give people hope is that I gave a keynote speech, which people can look up. It's online. And the title of that on my blog is "It's Time for the Medical Establishment to Admit We Made a terrible mistake." And in my keynote speech, I talked about the barriers to the truth being primarily psychological, not intellectual. And if people, and then I took them on a journey and said, I'm not going to bore you with lots of data on the COVID vaccine. I said, there's only one bit of data, one study you need to know about. And that should open your mind at the very least, or even get you to the point where you're thinking, we've got a major problem here. Yeah. And that was a Freeman study, which was a reanalysis of Pfizer and Moderna's trials, which revealed that from the very beginning, one was more likely to suffer serious harm from taking the vaccine. And Joseph Freeman in a video said this is actually, 2 to 4 times more likely to suffer serious harm from taking the COVID mRNA vaccine, Pfizer and Moderna, than to be hospitalized with COVID when everything is corrected for from the original trial data. Just think about that for a second, John. Yeah. Those trials are the ones that then led to the approval by the regulators, the coercion, and then mandates. But think about that, So I mentioned that in my talk, and this is the most heartening thing to mention, to discuss with you briefly, is at the end of the talk, I was going into the lion's den in many ways, but, John, for me, I'm not going to sugarcoat things. I'm going to be respectful, I'm going to be assertive, and I'm going to be persuasive in my advocacy. And that's what I tried to do in my speech. And there were no boos. There was a round of applause. I got many people coming up to me saying that was the best speech. People were gobsmacked. And I won't name these people because it's not fair to name them without their permission. Yeah. But 2 professors from Imperial College, one a transplant surgeon, one an orthopedic surgeon, who also got awards, by the way, they were sitting on my table. They were fascinated with what I've said. There was an element of, this now makes sense with what I've been seeing with my patients, etc. Here's my card, please contact me. The reason I'm mentioning that, John, is I think that there is a lot of people out there who understandably are very, very angry with what's happened. And that's predictable, if you like, with what happened with the mandates, coercions, people losing their jobs. But at the same time, there's a subsection of people, John, that feel that this was part of some kind of conspiracy, some sort of plan to depopulate for depopulation, to kill people. Now, I'm not saying that those people shouldn't have a voice and shouldn't be allowed to speak their mind. That's what democracy is about. That's what freedom of speech is about. And I'll always defend, their right to speak up, even if I disagree with them. But the more rational, logical approach, in my view, and certainly from my own experience, is that most of the people that have even been involved in supporting the rollout of the COVID vaccine, which I was one of, certainly for high-risk elderly at the beginning, is that they've only been subject to very limited information, which has been fueled and exacerbated by propaganda. But the positive side of all of it, John, is there is still a way there's a way to get through to them if information is articulated to them at the right place at the right time, maybe by the right person in the right way. And
it's
that means
interesting that
humility.
you're talking to senior doctors there who presumably have seen a change in the pathology that's presented to them and are thinking, actually that makes sense now, because there has been a change.
Clicked before, because as I said, when I went on Good Morning Britain at the beginning of 2021, I remember, there's something called hindsight bias.
Oh, yeah.
We were told at the very beginning, if you remember, this was only going to be for high-risk elderly. There was no talk about herd immunity. There was no giving it low-risk people. So in that context, for me, it was not even anywhere in my brain, in my consciousness, of significant vaccine injury, being an issue. I never come across the patient. I never heard of anyone who'd been vaccine injured, right?
Yeah.
So it wasn't something. So even if it was there, it was still a very, very rare occurrence. And I think, although Robert Kennedy Jr. has rightly asked for a independent review of traditional childhood vaccines, just I think more importantly to get more clarity and to regain trust.
Yeah.
The issue around, the COVID vaccine, of course, is a very different one, and we've seen the evidence is now overwhelming of stopping it. And that brings me on to the next point, which I'm sure you're aware of, which was also in many ways a positive step, I think, is that you've got a major respected, not a tabloid, a broadsheet newspaper, the Telegraph, on Sunday, interviewing me with a full-page feature, right, on this advocacy specifically. I think they were also interested in my role, having some advisory role, although I would call it soft power, if you like, of influence in the United States new administration, with my links to Robert Kennedy Jr. and Jay Bhattacharya and the grassroots non-profit organization called Malhotra Institute / Malhotra Action, who I'm a medical advisor to. They were interested in talking to me. They knew about my award in Parliament as well. So all these things then have a role to play. So, okay, well, I think we should chat to this guy. I'm also Chief Health Advisor to, and this will get more attention in the next few weeks, Action on World Health, which was co-founded by Nigel Farage, which actually is a organization that is going to be countering and calling out the shortcomings of the World Health Organization, asking them to be reformed or replaced. And there'll be more to come on that. So this is all happening in the background as well, and the Telegraph are aware of that. The person that interviewed me is a deputy political editor of the Telegraph newspaper. His name's Tony Diver, really nice guy. I met him in my clinic in Chelsea, where he came to, it's always better to have these conversations one-on-one in person, in my view.
Yeah. We're looking at the initial headline now, Aseem. The trust in doctors is at an all-time low. Medicine has been hijacked by big pharma.
Yeah.
Interestingly, I did check this before we came on air, and the headline's changed. It's got Aseem Malhotra. The harm caused by the COVID vaccine has been catastrophic. So it looks like they're being slightly bolder.
Absolutely. And I think that also may be in response. I got, a communication from Tony saying they've had a really great reception to the article. And I think they've probably also read the comments. I think there's been over 700 comments, which is quite a lot for a broadsheet online, to be honest. And I think they've seen and people, if you look at the comments on your YouTube channel, even the Mail Online, when I was doing stuff with them, calling for a moratorium on the COVID vaccine, mentioning the Hope Accord, which I know you've been very supportive of as well, which is a petition that's signed by thousands of doctors globally, hundreds in the UK, essentially amplifying or reiterating what I've been called for, and other doctors have called for years, is that I think they're realizing there's a shift, and it's happening. So that's a positive sign. But one interesting observation for people, if they read the article, by the way, it's free open access now on yahoo.com. So it's paywalled, but if people go to yahoo.com and they put in the title, COVID vaccine has been catastrophic public health, Aseem Malhotra, and yahoo.com, you can read the whole article. And it was very nice because they also talked about my upbringing, my parents, my school, the fact that I wrote an article at the age of 16 about institutional racism, and the fact that I've got in my nature, my character, to speak truth to power and call out shortcomings in institutions, and getting positive reports from the middle school master saying Aseem is courteous, kind, and epitomizes all that is good about Manchester Grammar School. with a sense of justice that does him proud, and that was when I was 16. So I think they wanted to kind of understand who is Aseem Malhotra as a person and why is he doing this, despite, you know, ongoing, continued medical persecution. John, this isn't a sob story, but there's a lot that we have to sacrifice here on our journey. And unfortunately from colleagues, not from patients, not really from members of the public, but from medical colleagues. And to have some sympathy with them and empathy with them, when I talk about the barriers to the truth being psychological, Gad Saad, evolutionary psychologist, talks about this in a recent interview with Jordan Peterson. So we've got the willful blindness, we've got the fear. But this is another one I hadn't really thought of. It's cognitive dissonance. So defined essentially by stress on the mind, when you've got contradictory bits of information. And one of the responses, John, to that is to double down. So let me just give you an example of this. Say you're a person that has been very heavily promoted, not to name anyone, but it could be, there's lots of people, that has heavily promoted the COVID vaccine, has been involved in the coercion and mandates, has even gone on TV, and this is something that, you know, some politicians said, that essentially you're an idiot if you don't take the vaccine. Imagine using that kind of language. Now, rather than when new information comes along, and there's two options you've got here. One is to say, hold on a minute, there's new information. It turns out I may have been wrong, right, with what I said, and it was probably inappropriate, and I'm sorry. Okay, that's
which is what you and me did.
Absolutely. Or you can double down, and you can go even harder and say all these people questioning the COVID vaccine are mad. They are, and this is actually quotes from Justin Trudeau, the Prime Minister of Canada, said that many of these people are racist and misogynists, anti-science, racists and misogynists, right? I know it's laughable, but they actually believe this stuff, John. That's what I'm saying. This is a psychological issue, and it can make people angry. We're like, hold on, let's try and understand it. And I'm not in any way, you know, letting them off the hook, but, you know, we need to understand where all of this vitriolic attacks towards people like myself and you are coming from, right? But the one final point I'm going to mention is that what was interesting in this article is there is a bit when you read up to it, and he's like, I'm saying it did more harm than good. And I have repeatedly cited Freeman's paper, peer-reviewed in the journal Vaccine. This is what got the attention of the professors at Imperial, by the way, which is, you know, subject to scrutiny, showing more harm than good from the beginning. The Telegraph, and there are many people involved, of course, in this, right? And they're what we call sub-editors, and this is where it probably happened. After my statement, they then cited a lower quality study. Almost certainly the authors will be ideologically blinded to this or have institutional ties to Big Pharma, I can guarantee that. But in the largest study of 99 million people, blah, 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 showed that vaccine side effects are very, very rare, okay? We know this is absolute nonsense. We know this is not in keeping with the totality of evidence.
And it's still being trotted out repeatedly.
Yeah, and they've admitted higher quality level evidence of independent analysis, including the co-author being the associate editor of the BMJ, right? So this is not the first time this has happened. This happened on Channel 4 News with Christian and Guru Murthy, an interview that we've talked about before online.
We did.
That interview was a whole hour. They edited it down to 20 minutes. I had longer responses. The support was extraordinary in terms of the Channel 4 News' own YouTube subscribers were overwhelmingly supporting me, despite only seeing a limited amount of my responses, okay? That was taken out. And this is a more interesting one, John. Somebody that I respect a lot, someone who's been an inspiration to me, and people can look up this online editorial in The Lancet, basically by Richard Horton in 2015, which is What is Medicine's 5 Sigma, something along those lines. But in that article, he basically says the private meeting took place, organized by the Wellcome Trust, with some of the world's top scientists. And he writes, Richard Horton, editor of The Lancet, writes, possibly half the published literature may simply be untrue. Talks about conflicts of interest in there, financial conflicts of interest in Big Pharma. And he finishes with this line, science has taken a turn towards darkness, but who's going to take the first step to clean up the system? I saw that as an inspiration for me to at least do my bit, right, as best as I could. And prior to my talk in Friend's House, which you came to and you were on the panel for in 2022, do you remember, in Houston? There was 1,000 people that turned up, okay? Richard Horton came to that talk. And I met Richard Horton in the street where I live in Hampstead. So we've messaged each other a few times, you know, WhatsApp him. And we stopped, we talked. He knew about I didn't know he was going to turn up to my talk, which was great. And he thanked me afterwards for name checking him in the talk. But the one thing I remember saying to him at the time, to Richard, said, Richard, what about this article in the journal Vaccine by Freeman and colleagues? And he paid attention. He said, well, that's a serious journal. That was his response, right? I then reiterated this very strongly, if you remember, in my talk.
Yeah.
Richard then wrote up, and to be fair, it wasn't a hatchet job, but in the end, there was an overall kind of what Aseem Malhotra is doing is potentially, fueling anger and conspiracy theories or whatever else, right? There's a little bit of a suggestion of that because of one very angry person, understandably angry because of probably what happened to her during the pandemic, who shouted out that I was part of the cabal, blah, blah, blah. And used a 4-letter expletive.
There was some abusive language at the meeting, unfortunately.
So Richard utilised that, unfortunately, to say this is reflective of all of the movement that are calling for transparency, which of course we know is not true. No. But the point I'm making is he omitted, he talked about British Health Foundation saying this and this and this, but he omitted to mention the Freeman paper. So we've now got, obviously the Telegraph, we've talked about, Channel 4 News, we've talked about Richard Horton and the Lancet. And I'm not blaming them as individuals or Telegraph at all. I think this is really positive that at least it's getting an airing. But I find it puzzling and baffling why you would omit the most important study that I have repeated again and again and again. And actually, for me, was what shifted me from just asking the question to saying there's a problem here, we need to look at it, to hold on a minute, this likely should never have been approved for a single human in the first place. Yep. That's all I'm saying. So that is interesting, and I think people should be aware of that.
Yeah,
but it is in my speech. It is in my speech in the Parliament, and that is also what turned, or what I think a lot of those doctors who were there paid attention to, because they understand the quality of that data.
Yep. Yeah, we had Joe Freeman on. He explained himself very well, and I think I like the start to this. You've got the greatest enemy of knowledge is not ignorance, but the illusion of knowledge, and that's where you go through these points: fear, willful blindness, and cognitive dissonance. There's something called cognitive harmony as well. I seem to remember from psychology. Albert Bandura, I think, was the psychologist who originally put that up. But yeah, cognitive dissonance is difficult to do a 180 on it. It's very hard to do. But well, I don't know. I don't find it too hard, actually. But you and me have done it. But many do find it difficult,
but John,
which is strange.
It's actually something that needs to be reinforced and ingrained in medical school.
Yeah.
Because one of the lessons in public health advocacy, and there's a great paper written by Simon Chapman, who is an Australian psychologist who was involved as a lead campaigner in tobacco control many years ago in Australia. And one of them is, as soon as the evidence, to maintain, it is critical and important to maintain trust in public health. When the evidence changes, so should you. Yeah. That hasn't happened. And in fact, one of the arguments I make that has been made in in BMJ Global Health, and the lead author, that's Kevin Bardosh in 2022, where they argue the case against dropping mandates for COVID vaccines, is that the distrust has been fueled because there has been a repeated attempt to, of course, coercion and mandates on the background of not accepting natural immunity, which we know is equally as effective at preventing infection and almost certainly more effective at preventing severe disease and death. That was ignored. The fact that there was no real questioning of an emergency use authorized product without the uncertainties attached to it, saying, by the way, ladies and gentlemen, we haven't tested this in the usual rigorous way. There may be harms we don't know about. This should be about informed consent. So because of all of that and everything that's emerged since, and the lack of acknowledgement, because one of the things as well, when you make a mistake in medicine, doctors are well-intentioned for sure. 99.999%, right, are well-intentioned. You get the occasional, very, very rare Harold Shipmans of this world, but most of them are well-intentioned. And because of that, when you make a mistake, to decrease anger and increase trust, the most important thing is, one, acknowledge the mistake, the harm that you've done to the patient, apologize for it, okay? And the third most important is, we are going to institute measures to make sure this never happens again or anyone else is harmed. And when you do that, patients actually respond positively. So at a public health scale, that hasn't happened yet, John. No. And that's why we need to keep pushing forward until the entire medical establishment say, hold on a minute, there's a problem here. Now, there's different approaches to this. My approach would be, I think this should never have been approved for a single human in the first place. But at the very least, they can say, listen, there were unintended harms. We didn't anticipate this. We're very, very sorry. We're going to try and do something to help the vaccine injured. And we're going to make sure that there are structures in place for greater transparency in medicine in the future that do not exist at the moment, i.e. why are regulators getting 86% of their funding from Big Pharma and they then claim to be independent? We know this is completely false.
Yeah. No, I mean, I think this is a big part of the problem. I mean, you talk about the commercial determinants of health in your speech, and so many people now believe that trust has been eroded. And I think unless there's some sort of, whatever you want to call it, confession and repentance or peace and reconciliation, that trust has been eroded, especially when that's combined with the extreme difficulties in accessing healthcare for many people in the UK at the moment and in the United States. The whole thing is really in quite a sorry state, and you refer to it as a corporate tyranny.
Absolutely. And by the way, just talking about the psychological barriers there, John, as well, what's interesting, I mentioned this in the Telegraph article, I've written that so we've got this, huge push by Big Pharma, as predicted, on the back of this narrative that they save millions of lives, which is highly questionable at best, is they're pushing more drugs on more people. So I'm seeing more patients coming on multiple cholesterol-lowering drugs now, which I predicted would happen because their business models to get as many people taking as many drugs for as long as possible. And now you've got Ozempic. Now I've got people, and there are people watching this who questioned the COVID vaccine, didn't take the COVID vaccine because of their distrust of Big Pharma, but are now taking Ozempic. This is clearly this is cognitive dissonance.
Other drugs. There's now a family of drugs in that class.
I have said very categorically, this will be a public health disaster in my view. This is not the best approach. There may be a role for very extreme cases of people who've tried everything else and that's the best thing they've got, but not for everybody else. And we've got we've got deaths now happening that have been reported because of these injectable weight loss interventions. We know it's not healthy in terms of the way you lose weight. You lose equal amounts of muscle mass, or almost equal amounts of muscle mass as you do body fat.
That's true.
It's causing bowel obstruction. It's causing pancreatitis. I've got patients contacting me. Angus Dalgleish makes this point that as a doctor, if there are two patients that you know of as one doctor that have come in with the same condition or same problem, the condition or the side effect is therefore not rare. I can tell you several people I know who have contacted me who've had a problem with Ozempic, right? So that is, again, this problem is not going to go away, because I've said that, some people said, oh, the COVID thing's done, what can we do about it? I said in my speech, some of you here may be ticking bombs, essentially, for premature heart disease and death and cancer, and you don't even know it. So, this is, again, we have to address this head on with the current problem, but also, unless we change the structures and systems that allow this to happen for the future, it'll keep happening again.
Yeah, I mean, two massive issues there. Some oncologists, and we know from this channel at least one senior surgeon and one senior physician are seeing more cases of unusual cancers that they've talked about. That is happening. Yeah. Well, what are these drugs called? Is it the glucagon peptide inhibitors or something? These weight loss drugs?
GLP-1s, yes, absolutely.
GLP-1s, yeah. So it's true that they cause muscle loss as well as adipose tissue loss.
They do.
Right.
What I said in my Telegraph piece is, my analogy was, it's not about weight loss, it's about health. Yeah. Right. And starving yourself to death is not a very healthy way to lose weight, and neither is being inflicted with cancer. And I said this is almost like I'm going to give you cancer to help you lose weight. This is the analogy I'm giving. Sounds very extreme. This is my real concern about this drug, John.
Yeah. More to come on that, sadly and unfortunately. And the last question I'd like to raise, Aseem, if you don't mind. You asked people to raise their hands if there's anyone there in that meeting that can name the 7 principles, the Nolan principles of efficacy in public life.
Yes.
Selflessness, objectivity, integrity, accountability, honesty, openness, leadership, motherhood, apple pie, nothing to disagree with. How many people raised their hands?
There was actually one. I was surprised there was one. There was one who could name them, and she actually was a corporate lawyer. interestingly.
Right. So she was
the
in
one
the field.
Next to me on my table. Yeah.
Yeah.
So she was the only one.
Yep. So let's hope that these are reintroduced with more clarity and consistency in future. We'll just say them again: selflessness, objectivity, integrity, accountability, honesty, openness, and leadership. Those would solve a lot of our problems.
Yeah, we need a cultural shift, John, where we judge people not on image, fame, and status or power. We judge them on their conduct. This is what we should be teaching our kids.
Absolutely.
This should be the
content of character.
Every single person, doctor in public life. If we do that, we will solve a lot of the world's problems, and we'll sort out the healthcare system as well.
It'll certainly be a good start. Dr. Aseem, thank you so much.
Brilliant. Thank you, John. Lovely to speak to you.
You too.